Hello. In this video, we're going to be discussing the idea of infection control and personal protection as related to OSHA requirements. A couple things is OSHA. OSHA stands for Occupational Safety and Health Administration. OSHA is a federal agency. The role of OSHA is to protect the American workforce. And so as a result, OSHA has guidelines for every industry that we have. So the construction industry has OSHA requirements, and the food industry has OSHA requirements, and every industry does. And in medicine, and which includes dentistry, we have OSHA requirements. And the purpose of the OSHA requirements is to protect the workforce from whatever hazards may be related to that particular industry. In our industry, it's going to be bloodborne pathogens or potential bloodborne pathogens. And those pathogens typically we would think to be hepatitis. We have hepatitis A or B or C, particularly hepatitis B. We also have to be very mindful of HIV infection, AIDS, because very often patients will be coming in, they'll be HIV positive, but they've never manifested any symptoms, so they don't know they're positive. And so we have to be mindful of that these folks coming to us will have potential pathogens about them. Could be virus, it could be bacteria, it could be fungus, but basically the OSHA requirements are designed to keep us free or safe from those pathogens. And so they have established a set of guidelines for us, all of us in medicine to follow. Every practice has guidelines to follow. And the guidelines are going to be found in what is called the Exposure Control Plan. The Exposure Control Plan is a document, or very often it's a book, that is put together by every practice. The University of Florida College of Dentistry has one. And in that document, in the Exposure Control Plan, which is unique to that particular practice, you're going to find procedures, policies, and practices that everyone is to be compliant with, and by doing so, everyone in the practice would then find themselves to be safe or safer from potential pathogens. Some of the things that we have to be looking for, or that we're going to be talking about, is within the Exposure Control Plan is going to be our work practice controls. That's the formal term for it, work practice controls. But basically, those are the things that we do and the things that we don't do in order to minimize risk. The other thing that is found within the Exposure Control Plan are things called engineering controls. Engineering controls are those things that we have at our disposal that will be useful for us to be protected. And those are going to be simple things such as soap and water, a sink, waterless hand cleaners. Most important that you're going to be dealing with are barrier protections, and we're going to be talking quite a bit about barrier protections. But that would include things like your surgical garments, your barriers, the gloves that you wear, the mask that you wear, and the glasses that you wear. And all of these things are part of the barrier protection, and those things would be found within the Exposure Control Plan as engineering controls. Okay, other kinds of things within engineering controls would be like steam autoclaves, disinfecting solutions that we would have that are available to us. And so work practice controls are the practices, the things that we do to protect ourselves. And engineering controls are the things that we have to use to protect ourselves. And so we're going to be talking about each of these in some degree of detail, because the thing we don't want for you as a volunteer is to find yourself at risk. None of us want to be at risk, and we want to do what we can do for you. Now, one thing to be especially mindful of when it comes to protecting yourself, and it is just that, to protect yourself. Ultimately, you have the responsibility to protect yourself from potential bloodborne pathogens. Okay, the school can give you the materials to work with, they can outline the procedures that you're to follow, but the diligence that you have of complying with these requirements are designed for one purpose, and that is to protect you. And so as you learn what to do, as you learn what not to do, take these things seriously, because the thing that you don't want is to find yourself with an illness that you contracted by being a part of the dental clinic. Universal precautions. Universal precautions is that which you can do, that which you can have in order to minimize risk. And several ideas you have to have in place in your mind. One is, assume that every person coming in the door is infected with something. If you assume they're not infected with anything, you're going to be tend to be lackadaisical or lax in your use of these materials and practices. But if you assume that if every person walking in the door is contaminated or infected with something and you don't want it, then you will tend to be very diligent about what to do. To understand that no bodily fluids from another person is to come in contact with you. Okay, now what would bodily fluids be? Well, there's all kinds, but within a dental context, we are going to be talking principally about blood, and we're going to talk about saliva. On some occasions, there might be tears. On other occasions, there might be nasal secretions, things of this nature, the fluids that would be coming out of a person in the head and neck area. So blood, saliva are going to be principal. And another is that for you to be protected, the notion or the concept of a physical barrier between them and you. Remember that bacteria really cannot move on the whole. They are not mobile. They can't move from point A to point B. Viruses cannot do that on their own. Fungus can't do that on their own in general. So the idea is, how does a virus or a bacterium get from point A to point B, from some other person to you? Well, it's got to be carried there. And so if you can create a physical barrier between where it is and where you are, okay, such as from a patient to you, if there's a physical barrier between these two things, between you and the patient, then the chance of getting contaminated with a potential blood-borne pathogen is much, much reduced. And this leads to the idea of our personal protective equipment. And you'll hear it as PPE, personal protective equipment. And the four things that we typically have in the dental clinic are going to be some kind of a gown to wear. There's a variety of styles. The other is our face mask that we wear to cover our nose and our mouth, our glasses that are going to be covering our eyes, and then the gloves that we wear. And our hands are going to be most likely to be contaminated, because that's where our hands are being placed in the patient's mouth. Our hands are touching instruments that are contaminated, and so our gloves are going to be principal to helping us. So at no time, in order to be in compliance or to have in place the idea of universal precautions, keep in mind that everybody's contaminated and you don't want anything from them to get to you, and the way to do it is diligence on your part and the use of your personal protective equipment. Another concept that I wanted to share with you to help you, because there's no way that you can remember all the rules and regulations, but you can remember a couple of principles. And one principle I want to share is the notion of what is clean and what is unclean. Now, these are just terms that I have chosen to indicate things that you can touch with bare hands and the things that you cannot touch with bare hands. So, what would be clean? Clean are those things that you can touch with your bare hands. They would be things like your computer, your pencils, paperwork, doorknobs, anything in the front office, typewriters, or anything along these lines that you can touch with your bare hands. Things that someone who is naive to clinical environment and they don't really understand protocol, that they can come into the space and they could touch these things with their bare hands and feel comfortable to do so. Those we kind of put in the clean category. Unclean. Unclean is a general category, or those things that would likely be contaminated with a potential pathogen. And so what would that be? Well, certainly anything that has come in contact with the patient. So that would be instruments, old drapes, or covers that a patient might have, gloves that you're wearing that have come in contact with the patient. If you're wearing your face mask or glasses and maybe there was a splash or a spray of some kind of bodily fluid on you, then those things become unclean. And so those things you would not want to touch except if you have gloves on. So if we can understand that it's our responsibility in the clinic to not only protect ourselves, but it is to protect other people who come into the space, come into the clinic, such as, say, a secretary or a person who is a delivery person or something like this, who come into the space and they're not familiar with what they're to do and not do. The idea is that we keep the clean clean. As you can see here, these are items that are commonly thought to be clean. The inside of the Alabama cart, particularly office supplies, communication devices within the office, things in the storage area such as bottles, also new packaging, and that sort of thing. Things that are unclean though, such as sterilization area, when you're in this kind of space, wear your gloves. Available to us to minimize risk, and I wanted to point out a few things that are in that category. First, our personal protective equipment. All of those things are. The sinks that we have with soap and water, our antimicrobial soaps, the brushes that we use for our fingers and things like that, all part of engineering controls. If we do not have access to a sink, our waterless hand cleaners. Waterless hand cleaners should be available at all times. You never know if there's some kind of a failure in our system that the water doesn't flow and you need to disinfect your hands. So if your water's not flowing, you can't use soap and water, then you use waterless hand cleaners. Paper towels. You notice we don't use cloth towels to wipe our hands with because that's a pathway of contamination from one patient to another through our washing our hands, and so we always use paper towels. You've seen images, or you'll be seeing images of these things, our sharps boxes, which is where we put all of our items that have the potential to cut you, and so that would be needles, scalpel blades, things of this nature. The red bags or hazardous waste bags, those are going to be the things that we have that are that will store in things like blood-soaked gauze. Extracted teeth would likely go in there. If there's gowns that are grossly contaminated with blood or some bodily fluid, those would go in the red bags. The kinds of things that can go into the regular trash are things that are not really soaked, blood soaked. And so that's a kind of a distinction that OSHA makes, is that in the red bags, if an item is blood soaked, it'll go in a red bag, it'll go in biohazardous waste, but if it has just a small splatter or something of blood, that could go into the regular trash. Remember that the maintenance staff, janitorial staff, they too are familiar with what the OSHA requirements are, and they don't work in these environments without their gloves on. And so be mindful of what you put into the trash. So no needle or hypodermic needle or suture needle or the glass vial, the carpules that we've talked about in the previous videos, the carpules, all that sort of thing should go in the sharps boxes because they have the potential to cut somebody or poke holes in it. As we close this video, concerning ourselves with personal protection, we're using as a foundation the OSHA requirements through the exposure control plan that we keep in our mind two items. One is our own personal diligence and responsibility to protect ourselves and our coworkers, and understand that the policies and the procedures that are in place through the exposure control plan are designed to protect us so that we can continue on in our role as a worker in some capacity. So OSHA is on our team, and all the rules and all the regulations are there for our protection. So don't look at that as rules. Rules are made to be broken. No, these rules are made to be complied with, and again, it's for your safety. Thank you.